Hello. This presentation by FERNE discusses the care of emergency department patients with dizziness and vertigo in an attempt to diagnose and treat serious central etiologies. My name is Edward Sloan. I'm an emergency physician in Chicago. I have served as the FERNE president and board chair for 3 decades. I have no financial conflicts. I encourage you to go to our website, FERNE.org, and our YouTube channel for more content related to the optimal care of patients with dizziness and vertigo. Follow us on social media also for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, FERNE.org. So we're talking about patients who present with dizziness and vertigo, and it's important to discuss relevant disease states that can cause these symptoms. So our differential is quite long. In alphabetical order, we present alternobaric vertigo. In other words, changing in barometric pressure, such as with scuba diving, you can have a ruptured TM and end up with vertiginous symptoms. Benign paroxysmal positional vertigo, BPPV, is thought to be peripheral as a result of movement of the head. More serious central causes include brainstem infarction and vertigo that is central or caused by the brain itself, not the organs in the periphery. Cerebellar dysfunction or ischemia or infarct is a very serious cause of dizziness, vertigo, and vomiting because any swelling in the posterior fossa by the cerebellum will cause pressure on the brainstem and possible herniation. Anterior ischemic stroke, or a TIA, can also cause dizziness and vertigo. Labyrinthitis is a peripheral cause related to inflammation of the labyrinthine structures. Meniere's disease can cause hearing loss, dizziness, vertigo. Other causes in alphabetical order include migraine-associated vertigo. That is, with vertigo, with migraines, vertigo can occur. With motion sickness, you can have dizziness, vertigo. With peripheral vertigo, you will have dizzy symptoms. There's something called persistent postural perceptual dizziness related to changes in position. Vertebral basilar insufficiency and stroke is a posterior cause of stroke and infarction. Vestibular neuritis or neuritis is inflammation of the vestibular nerve and those structures that carry input from the ear to the brain. And last is Wallenberg syndrome, which is a neurological condition also referred to as lateral medullary syndrome or posterior inferior cerebellar artery syndrome, associated with many important symptoms that should direct you to the consideration of a central stroke. So as we talk about this differential diagnosis of patients with dizziness and vomiting, we can see there are many etiologies of these symptoms, some peripheral, some central, and our job as the emergency physician is to figure out how we can determine whether or not is a central or peripheral cause of the dizziness and vertigo. If you have comments or questions, please get a hold of us at fern.org at gmail.com. Thank you for your time. Have a good day.